Hello, and welcome to our NCLEX bootcamp session focusing on pharmacological therapies. My name is Dr. Jessie Wheatley, and I'm one of your NCLEX success specialists. In this section, we will cover essential nursing responsibilities for self-medication administration, monitoring adverse effects, dosage calculations, expected medication actions, and pain management. All these are part of the physiological integrity category of the NCLEX PN. Let's dive deeper into the pharmacological therapies category, whereby the LPN/LVN provides care related to the administration of medications and monitors clients who are receiving parenteral medication therapies. Nurses must identify medication incompatibilities. They must recognize contraindications and watch for symptoms of allergic reactions or adverse effects. If adverse effects happen, nurses need to withhold medication, take appropriate actions to counteract them, and notify the provider. Always monitor, document, and reinforce client teaching on possible side effects and when to report them. Continue monitoring for medication interactions, whether oral, IV, topical, or other routes. You need to make sure that you document side effects and the client's response to how they are managed. Notify your provider if adverse effects develop and use clinical judgment when calculating safe doses for administration. Let us expand more on dosage calculations. Safe dosage calculations is non-negotiable for nurses. Know how to calculate dosages accurately for your NCLEX exam and for your practice. Especially when mixing medications like insulin from 2 vials, you need to be able to show that you can do that safely. And always double check your math in conversions when you have a math question. Use sound clinical decision making and never guess an answer on a math question. It is very important for nurses to remember that they must know why a medication is given and the expected response for the client. So pay attention to when medications are mentioned in questions. Use reliable resources to confirm the purpose, the actions, and the interactions of the medications. Never guess. Apply your pathophysiology knowledge. Reinforce client teaching on actions and therapeutic effects, and always evaluate the client's response by monitoring the lab values, the reactions, and expected outcomes that are presented. It's important that you remember to follow the rites of medication administration. Right patient, right medication, right dose, the right time, the right route, and right documentation. Safely store meds, check expiration dates, and keep accurate medication lists. Gather all your necessary data before giving a medication, like allergies or current meds. You need to know those. And assist with the preparation for procedures like central line insertions. In addition, it is important to remember to administer meds via the prescribed routes safely. So different routes like oral, IV, IV piggyback, GI tubes, injections, topical, or inhalation. You need to also remember to dispose of unused meds properly and count controlled substances carefully, reporting any discrepancies that you see. You want to calculate and monitor IV flow rates and blood transfusions safely. Teach your clients how to self-administer meds like insulin, and they also need to be consistent and confident and accurate. Client need category also includes pain management, pharmacological pain management. Pain management is vital to client comfort and recovery. You must show that you can identify when a client needs pain meds. You need to show that you can monitor their response with pain scales and reports. And you need to be able to show that you can manage pain control devices like epidurals or PCA pumps safely. Document everything, especially the client's response to your interventions. We have covered a lot of principles regarding pharmacological therapies. Now, let us put these into practice with a case study. We have a 76-year-old client who was started on digoxin, who now feels dizzy and weak. They also are on a diuretic, on a beta blocker, on an ACE inhibitor, and insulin. Please take note of their assessment findings. These are key to evaluating medication safely and possible complications that may occur. When you have a case study, it's very important to make sure that you read the question in the scenario and you understand all aspects of care. It's important for you to understand all the information that's provided prior to reading and answering any case study questions. This is similar to you being in a clinical setting. You would not provide care or answer any client questions until you have received a report and assumed care. Please make sure you use the same due diligence when answering questions. Please take time to study the client that we're going to be caring for. This is a 76-year-old client who reports feeling dizzy and weak for 2 days. The client was started on digoxin 6 days ago. Please take time to look at the current medications and know what they're used for and understand the dosages. Please take time to look at the medical diagnosis and the medical history of this client. Please take time to review the assessment notes prior to answering any questions regarding this client. After reviewing this case study scenario and the client record, we are now ready to assume care and we can move to the first case study question 1. The nurse reviews the client's medication regimen. First, identify findings related to the medication safety profile of this patient. So we are being asked to highlight client findings that are relevant to evaluating the client's current medication therapy. Low to normal blood pressure, bradycardia at 52 beats per minute, weight loss, nausea, poor appetite, yellow vision halos, mild pedal edema, and reports of increasing sleeping. These are all potential red flags for medication complications, especially for digoxin toxicity. So in answering this question and highlighting client findings that are relevant to evaluating the client's current medication therapy, we would say and highlight the heart rate of 52 beats per minute, the weight loss, the nausea and poor appetite, the visual changes, and the client reporting being sleepy. The second question in our case study will have us analyzing cues. So in this question, the client's symptoms suggest several possible scenarios, and his age and another factor places him at higher risk of medication-related complications. So we will use a drop-down question type to go ahead and answer the question. We're going to analyze what these signs mean. The symptoms suggest possible digoxin toxicity. The client's age and multiple medications place them at higher risk for complications like bradycardia and electrolyte imbalances. In answering this question, using the drop-down, we would conclude that the client's symptoms suggest possible digoxin toxicity, and his age and renal impairment places him at higher risk for medication-related complications. Remember that this patient has classic signs of digoxin toxicity and has stage 3 chronic kidney disease. They increase the risk due to reduced drug clearance. Question 3 of 6 of the case study will have us prioritizing a hypothesis. For each client finding, we need to indicate whether it is due to normal aging or due to fluid loss from diuretic or digoxin toxicity or a beta blocker side effect. Please review the client findings carefully, and please indicate what you think might be happening here. Feel free to pause the video so that you can take the time you need to be able to answer this question correctly. Great job attempting to analyze the cues in this matrix grid question. Let's analyze it further. We need to look at what's going on and break it down. Which finding matches which cause? For example, there's dizziness and bradycardia here. They may be related to beta blocker or digoxin side effects. We have yellow vision halos that are classic digoxin toxicity signs. We have weight loss. That could be from fluid loss due to the diuretic. Please remember that analyzing these cues guides your nursing actions and ensures safe nursing practice. Step, we will go ahead and generate solutions. Which nursing actions are appropriate for this client here? Do we hold the next dose of digoxin? Do we notify the provider? Do we go ahead and check the serum digoxin levels? And what about the other answer choices? Right. We're going to hold the next dose of digoxin. We're going to notify the provider. We're going to check the serum digoxin level and monitor the cardiac rhythm. Do not administer another dose until levels are checked. An antiemetic may mask symptoms, so hold off until you clarify orders. Always act to protect the client first. Remember that we have key actions that must be undertaken when digoxin toxicity is suspected, as it is in this case. antiemetics, and potassium should not be given without lab confirmation or provider guidance. Five of our case study, the nurse is reviewing the discharge plan. The nurse is asked to drag the steps below into correct order for planning and implementing the client's discharge. In finding the correct order in a question like this, always begin with a focused assessment, then prevent further harm by holding the medication, escalate the care that is needed, gather diagnostic data, and then provide ongoing monitoring for the patient. Remember that you need to do first things first and be able to take several actions in order. So, focused assessment, then you prevent further harm by holding the medication. You want to escalate care, notify the provider, and then you want to gather diagnostic data and then provide ongoing monitoring. Finally, how do we know the issue that we started with has been resolved? In this case study, which of the following findings, if present at the next visit, would indicate successful management of the medication-related issue? This is a select N, so it has you select 3 answer choices. Safe outcomes would include a normal heart rate of around 72 beats per minute, a therapeutic digoxin level between 0.5 and 2.0. Here we have a 0.8, which is good, and improved appetite and energy is good. We want to make sure that we're not selecting ongoing yellow vision, which indicates the issue isn't resolved yet, and the sudden weight gain would mean fluid retention and worsening heart failure. Wraps up our pharmacological therapy review. Remember, safe medication administration and monitoring saves lives. You have any questions, please reach out to us. We're here to help you succeed on your NCLEX PN and in your practice. You've got this. You can do it.